One thing I pride myself on is taking the time to slow down and pay very close attention to details when I'm doing facial rejuvenation, whether it's with injectables or whether it's surgically, because the face is something that the patient sees all the time in the mirror, many times a day, and their friends and family see it, and it's not something that you can hide underneath clothing. So I believe, in my philosophy is that I take the time to make sure that things look right. Initially, for a surgical procedure to rejuvenate their face, it's very important to do a careful analysis at the very beginning when I first meet a patient about what is really the problem. If a patient has problems with jowls or loose hanging skin underneath the chin, I do what's called a smash facelift, which involves lifting the deeper structures, getting a tightening effect which will raise the jowls and will eliminate the loose hanging skin underneath the jaw. If they're a candidate for surgical rejuvenation, that may be the form of having a rhinoplasty, which means a nose job or reshaping of the nose, refining the nose, taking off humps or bumps, or refining the tip of the nose to make it look more appealing. They may have problems with their eyelids, where their eyelids are sagging or becoming loose, and that may involve a surgical procedure that removes some of the extra skin of the eyelid or removes some of the bags that are underneath the eyelid. A lot of times a patient will think that the fix-all for their problem is a facelift, where instead there may be a less invasive way of helping their face to look younger using injectables or fat grafting or Botox or skin treatments that can make their face look a lot better and save them a lot of money compared to doing a full facelift.
He walked in and I was kind of pulling back a little bit, and he said, "What are you doing? What are you worried about?" And I was explaining how I feel like this part of my face is just kind of sinking in and it's making me look a little old, and that maybe I'm ready for a facelift. I'm a few years away from it. And he said, "No, Voluma can actually fix that area."
I came to Dr. Doezie for Botox because of my scowl lines, and because I felt like I was always scowling and I wanted to try and prevent them from getting worse.
I get Botox from Dr. Doezie every 3 months without fail. I get it for my migraines as well as for the obvious reasons of wrinkles.
I trust Dr. Doezie because I know that he has a very conservative aesthetic, and I don't want to, I'm 45 years old, I don't mind being 45 years old, I just don't want to look exhausted and tired, but I want to look very natural. And I can trust that he is going to give me that result to where we can do little edits and I can age gracefully, and nobody's going to look at me and think that I've been reworked in any way.
With non-surgical facial rejuvenation, there's a lot less recovery time, there's a lot less money that they have to spend to get sometimes some similar results. But there may be times when a facelift is necessary, and I will be very upfront and honest and tell the patient when they are a good candidate for a given surgical procedure for the face.